Yesterday, last night, I got a consult from Sarawak in Kuching, Sarawak GH. A patient bitten in bau. You know bau? Bau ke bau? The spelling is B-A-U. Huh? So, bau lah. Nampak bunyi sedap sikit. Bau tu lain macam pula nanti. So, it's bau hospital. They saw the patient. They give the wrong treatment. Is this going to be legal? No. They provide the inappropriate treatment and send the patient to Kuching Hospital without consulting us early. So we can't help them. So patient datang is already in respiratory distress. Patient already in respiratory failure. Saturation was 85. Okay, and patient was unable to move. Okay, and also having some difficulty breathing. So they had to intubate the patient. In Kuching, they consulted us, straight away show us the picture of the bitten area and the signs, and we start antivenom for the patient. And this morning, this patient was given at 3 o'clock last night, 3 o'clock in the morning, the antivenom was given. 6 o'clock in the morning, patient already open eyes, moving, and the patient can be extubated. Okay? Actually, this patient doesn't need intubation if we were able to give the appropriate hospital in Bau Hospital. Okay, so this is one of the reasons why we are in demand in terms of Rex consult, because this small hospital can call us direct and we can tell them what to do appropriately. Because yes sir.
What snake bite was it?
It was a cobra bite. No, Naja is only in India. There's no Naja in Malaysia. What were you teaching students? Okay, so in Malaysia there's only 2 Naja species, which is one Naja cauthea, which is only present in Semenanjung. And in Semenanjung also in northern part, actually up to, again, HUKM, north. Okay, Sabah Sarawak tak ada Naja cauthea. Okay, that's the cobra with one sign at the back, okay, monocle. The other one is Naja sumatrana. That is a spitting cobra or equatorial spitting cobra. And it can spit venom. Oh no, it can spray venom, sorry. Does this name correct? Spitting cobra? Nampak you? It's a spitting cobra. But this cobra doesn't do that. Okay, it sprays venom. And that caused the venom ophthalmia. The child that you saw just now was actually bitten by Naja sumatrana. So the patient was bitten by Naja sumatrana. Yeah, because it was in Sarawak. Okay, so we gave him the antivenom, and the patient recovered well. So antivenom in Semenanjung and Sabah Sarawak are only stocked in at least district hospital. Okay, right? So at the moment, antivenom are only stocked up to the level of district hospital and tertiary hospital, of course. Okay, so that's why we say go to the hospital because the, management is going to be appropriate at these centers. In this center, what is normally done is for us to assess the condition of the patient, okay, and to reach a diagnosis, so that we can impart the appropriate treatment. Now, this is the management flow for snake bite. Patient came, the first thing we do is, of course, in emergency department, we check for the ABC. You know what ABC is? Air batu campur. Airway breathing circulation, everything is stable. Then only we look at other things. First is to confirm whether it is actually snake bite or not, okay, and to identify the species, to define the systemic and local signs, and also to continue observing. If there are, then most likely the patient will require antivenom, right? So it's not straight away bitten by snake, antivenom. No, okay. That is what is being in the mind of the community. Saya kena patuk ular ke? Saya nak antivenom. Oh, saya kata ular apa? Ular buta. Ular buta. Ada tak ular buta? Do we have ular buta? Blind snakes. We have several species. They call Typhlops group. They look under the tanah. So ular ni tak ada mata. Bukan ada mata tapi non-functional. Okay, dia makan cacing. Anyway, antivenom is only when it is necessary. Only when there's a sign and symptoms of envenoming, then you can give antivenom. Which antivenom? We'll talk about this after this. Observation is crucial. Yeah? And observation not just from the emergency department, but also even after antivenom is given. Because we need to know whether that treatment is actually going to be successful or not. If you don't observe the patient after antivenom is given, how do you know that it is actually not a failure of therapy? Okay? So, observation must be continuous, and then later on whether the patient requires discharge or other treatment. If you give antivenom, the patient most likely no need for ICU treatment. Okay, no need to be admitted to ICU. So that's save costs as well. Like that man just now, only 3 hours in the ICU because he was intubated and he will be extubated, now back in the normal ward. That room in that bed for ICU is given to someone who really needs it. Okay, so this is how we reduce costs for what we call healthcare services. Now, clear and complete history is very, very important. We have to be like Sherlock Holmes to get all the details from the patient in order for us to impart appropriate management. Okay, so these are some of the things that we do. We have to examine the area that is bitten, as you see just now, the leg, for example. Okay, the bite site, the general signs and symptoms, okay, and also the specific signs and symptoms. So that you have to know lah. I can't tell you in this short period of time. You can attend our courses after this in the future. Investigations. These are the 3 crucial investigations that all patients should get or should be done on patient. FBC, full blood count. We look at the white blood cell count and also the platelet count. The coagulation profile, the PT and ABTT, and also the INR, and the CK, because some of it can cause local necrosis and cause muscle necrosis as well. Okay, so these are the 3 usual blood tests that we ask for. But there are other blood tests which will be required as time goes on and as the signs and symptoms appears. Okay, for example, liver function test, fibrinogen level, and also PT-ABTT. D-dimer. Okay, so depending on the case and the signs and symptoms of patient. Okay, the other thing that we do is in the ER or in the hospital is about reassessing the patient and keep on monitoring. What do we monitor? We monitor the vital signs, obviously, but we monitor also the progression of the edema. You see just now the swelling, we have to see whether it is still progressing or is it decreasing. Okay, patient datang 2 days later with snake bite, swelling. Are you going to start giving antivenom? No, you have to know whether that swelling is still going, progressing, or is it already reducing. Okay, so if you reduce it, obviously there's no need for antivenom. If it is progressing, how fast is the progress? Okay, so these are all the things that need to be monitored closely. Pain. Do you think that the child, the lady and the hand is now without pain? It's very, very painful. Okay, with that type of injury, obviously cause a lot of pain. So we measure pain score. You know how to measure pain score? Are you in pain now? What's your pain score now? 0, no pain. 10, the worst pain imaginable. Is it painful lecture to listen to? It's damn painful. Okay, sorry about that. You're forced to come here. Well, that's it. I can't help. Maybe you can take 1 paracetamol after this. Okay, what does this suggest? If someone comes to you and the doctor take blood and put in a glass bottle, what does this suggest? Still bleeding, you can see from the bite side. So this is one bedside test we call 20-minute whole blood clotting test. And this is basically a test to see whether that patient, after 20 minutes, if the blood doesn't clot, it means that the patient is actually having systemic envenoming. Okay? And what causes systemic envenoming from this is actually most likely from a pit viper. Which pit viper? It doesn't say. Okay? It only tells you the blood doesn't clot. It doesn't tell you which species of snake that caused this. But we know that the one that can cause this only from pit vipers. And we have a lot of pit vipers in Malaysia. Okay? They're all very beautiful. Okay, now let's talk a bit about how much time do I have? 20 minutes? 15 only? Oh, yeah. Okay. Antivenom. Now, antivenom is actually antibodies. Okay? Which antibodies or whose antibodies is actually from the host. Who's the host? It's actually the horse. Okay? Depends on which antivenom you use, Most of the time, the one that is actually producing these antivenom and antibodies are from the horse. So how it is produced? One, you have to have the venom of the snake. The venom of the snake that you want to produce antibody. So in this picture, you can see this is a king cobra. Okay, can you see it's a king cobra? Very different from the picture just now, right? This is a king cobra, not so kingy anymore. And this is the Malayan pit viper. Okay, so they collect the venom. Then what they do is, first the snake must be healthy lah. First, then the venom is collected, as you can see, is injected into the host, and this is the horse. And it's not only one injection, but many times, so that the horse becomes hyper-immunized. So in a hyper-immunized state, the antibody titer in the body of the horse is high. Okay, it's a lot. And then it will, the horse must be healthy as well. Okay, it's like Beauties. Okay, it will then donate the blood, it produces the antibody, and this is extracted in the blood and processed. So it's separated in the kilang. So in the kilang, they will break down the antibody further. The one that is actually packaged is the A and B chain. Okay, there are three chains, A, B, and C. C is the one that they remove by pepsin, and this is the active component that will bind to the venom. Right? Now the venom that it will bind is in the circulation of your body, if you're envenomed. So this antibody will bind to the venom and it becomes neutralized. Okay? So this is the active part, the A and B chain. So these are two FNAB, so that's why we call it FAB2. Right? Now, it will then be packaged very nicely. Now for Malaysia, we do not produce antivenom. We don't manufacture antivenom. We have to import the antivenom. Okay, so we import from the country that is closely resembled in terms of the species to our country. So that country, alhamdulillah, is close by, it's just Thailand. And they have very good manufacturing practice for quite some time already, and they produce these antivenoms. So these antivenoms are specific for each of the species. As you can see, there's only one picture of snake there. So this one is for king cobra. This one is for the green pit viper. This is actually Tropidolemus albolabris. Okay. This one is Dahoya rusali, which is not present in Malaysia. So we do not have to buy this antivenom. The other one is the Bungarus fasciatus, okay, or banded crate. Malayan pit viper, as you said just now. Okay, cobra, this is the monocle cobra, but we can use this also for the envenoming from the Naja sumatrana as well. Okay, because that's closely related, and we see in our lab test there's quite good cross neutralization between the two. Okay, we saw the child just now in Sabah. Okay, even though Sabah don't have monocle cobra, but they stock Naja cauthia antivenom as well. So we gave it to the child, and child was okay, right? So this is one thing that pharmacists should know. You don't have a species, but there is actually cross neutralization. That's why you keep, right? And the other one is the Malayan crate or Bungarus candidus, right? So these are all only specific for that particular species. What about if you don't have the species to identify and patient has symptoms? So what we have is what we call the polyspecific. Now these are actually the same as the mono, but in one pack there are more than one. Okay, so we term it as the hematopoly and the neuropoly. Okay, this is actually comprised of three different pit vipers, but for us the two relevant ones are for the green pit viper and the Malayan pit viper. Okay, now patient must have signs and symptoms of hematotoxicity before you can give this. Right? The issue is we just don't know which one caused that sign and symptoms. Okay, in Sabah and Sarawak you don't have to keep this because there's no Malayan pit viper. So what you need to keep is only for the green pit viper. Now for the neuropolyvalent, there are 4 species. Okay, the 2 crates, 1 cobra, and 1 king cobra. These 2 are not related at all because of the name cobra. Don't think that Naja is the same as Ophiophagus. They're 2 totally different genus. Okay, so king cobra is not a true cobra. Okay, we only have 2 cobras, as I said just now. So this one is only for somebody present with the neuro symptoms, and you don't know what are the species, what is the species that bite the patient. This one is not antivenom. This is ayam. Okay. So the other one that we had to import is the sea snake antivenom. Now, sea snake antivenom is less complicated because it is applied to all sea snakes. Okay. You don't have to know the species of the sea snake to give the sea snake antivenom, right? So you don't know the species, but the patient came from the sea, bitten by a sea snake, don't know what species, and with symptoms, you can give the sea snake antivenom. Price, is it expensive? How much? How much is expensive for you? Your expensive is not the same as expensive from the lecturer. Lecturer satu batu zamrud, okay lagi. Yeah? So this one is 17,000. One vial. You may need to use 3 vials for patient. We use 5 vials one time for a patient bitten by a sea snake with signs and symptoms in Teluk Intan. 5 vials. In the ICU for 1 week, patient went home well. Okay, a miracle of antivenom. The rest, hematopolie is around 500 ringgit or about 150 US dollars. The monovalent is about 100 US dollars. Okay, depending on the currency status lah. Sekarang ni mungkin lagi mahal daripada tahun lepas lah kan, because of the currency exchange. Now, what are the indications for antivenom? Now, this one will depends on what you see from the local signs, swelling, pain, blistering, just now as you can see, and necrosis as well, and how fast it is moving. And the other one is systemic. So neuroscience, ptosis as you see, difficulty breathing, swallowing, difficulty in swallowing the saliva, causing pooling of the saliva, and also paralysis. Okay, so these are the signs and symptoms that the doctor need to observe closely in the ward. So what are the contraindications for antivenom? Any contraindication? What about pregnant ladies? Anybody pregnant here? Tak mengaku lah kan? Tak apalah. Mungkin nak beritahu lepas raya kan? Okay. So there's no contraindication for antivenom. If you are pregnant also and you get bitten, that's indication for antivenom. You can receive antivenom. There's no issue with the unborn child. Alright. So what about if you were allergic to antivenom before this, and you got bitten again because you're so lucky, and you require antivenom? Is it okay to give? Yes, because antivenom is the only antidote for envenoming. Okay, whether you are allergic to it or not, lain cerita, because you can manage allergy with other drugs. Okay, but the envenoming is only that. So if you were given antivenom, you develop allergic reaction, anaphylaxis, while it is still running, you just stop, treat the anaphylaxis. Once it's resolved, restart back the antivenom. Don't throw away that antivenom. It's damn expensive. Okay? We had a case, I have a lot of stories, but time doesn't permit. Maybe next course, we can discuss. Anyway, so which antivenom to use will depend on the species, or you know or not the species. Okay, as we have already discussed just now. You can have a look again at the video. So, what is the dose? How much is enough for a patient? 1 vial? 1 vial? Okay, I'll give you an example. If you're bitten by a king cobra, the first dose, okay, the initial dose, it's not 1 vial. The initial dose is 10 vials. So 500 ringgit times 10, 5,000, one shot. We just gave 10 vials to a patient yesterday in my hospital, bitten by a cobra. Also, the first dose is 10 vials. Okay, if it was a crate, then it's 5 vials. The Malay pit viper and the pit vipers are 3 vials as the initial dose. Okay, sea snake aja yang starting dia, first dose is 1 vial. Okay, and then you see whether the patient requires second vial or not, or third vials and subsequently. Okay, so one patient we treat for king cobra in Penang a few years, 2014, we had to give him 32 vials. So that's repeated 3 times, plus another 2 just to be sure. That was not my decision. That was the decision by people who has no confidence. Okay. So anyway, that's the dose of antivenom. So don't be afraid when the doctor call you at night and said, "I want 10 vials." Oh, banyak sangat doktor, bagi satu dulu lah. Okay, means that you have not seen the link that I provided to you earlier. Okay. So now, how to prepare the antivenom? how do you know that which antivenom is appropriate for your hospital? So we have a formula that you can use. This one is for pharmacists. How you can calculate the estimate for the initial basal stock. Okay, the hospital tak ada antivenom, baru nak start, how much you need at that particular time. So this is the formula. You have to have a database of snake bite, and that snake bite must be the one that required antivenom and must be verified. So it needs a bit of research. Okay, then you can use this formula and you can recommend to your hospital administration how much antivenom is for your hospital. Okay, not all hospitals require sea snake antivenom. For example, Cameron Highland, why the hell you want to have sea snake antivenom? Okay, just because it's in the blue book of KKM, you said, oh, must stop antivenom. Itu ada sea snake. Kita belilah juga satu vial cukup lah, Cameron Highland. How does that happen? You know, maybe orang tu mandi kat Porison kena gigit, then dia naik ke Cameron Highland bercuti. Well, yeah. So it just shows that each individual hospital will require a different amount and different type of antivenom, and research is pivotal. Okay, so that's what REX comes in as well. We help in the identification process. We help make sure that all the cases are verified so that you can confidently come up with this recommendation for estimation for the hospital. How to prepare antivenom? Antivenom comes in dry powder form except for the sea snake, which are in the liquid form. So to prepare the antivenom, you have to actually look at what we call the type, and there in the link I gave you, in the guideline, there's a very clear guide on how to mix the antivenom. Okay, so first you have to what we call reconstitute, and then mix with the others and dilute. Okay, then you start to administer. There's no more test dose for antivenom. Okay, it's not like antibiotics. IV. Okay, there's no test dose. It doesn't work. It doesn't make sense why you want to do test dose for antivenom. Okay, we discussed that in the higher level course. How to administer antivenom is only by IV, intravenous. No more jab to the heart. Oh, saya kena gigi kata, cucuk. No, there's no such thing as that. Or even IM injections. Okay, those all intravascular. Right? Intravascular means either intraosseous or intravenous. Okay? You know what's intraosseous? Intraosseous, pernah dengar? You put in the IV cannula into your long bones. Okay? And that gives you access from the marrow blood supply. So that's venous supply. Okay? We do this in emergency department. Susah nak sangat cocok dia tulang. Called intraosseous. Then, what to watch out for? Antivenom, the risk of antivenom giving antivenom is actually anaphylaxis. Or it's not just anaphylaxis, it's actually anaphylactoid. Okay? So treatment is the same. We give adrenaline as the first line, IM. Okay? Then we may want to convert to IV, and plus the other supportive therapy, steroids, chlorpheniramine, ranitidine, or all the antihistamines. Okay, so adrenaline must be on the standby before you give antivenom. When is it enough? It's when the signs and symptoms are reversed. Okay, that's where the close serial monitoring is very important. Okay, you want to see if somebody before giving antivenom pain score 10 plus. Okay, 10 plus, maximum 10. So 10 over 10 after giving the antivenom, which is about 1 hour. Okay, it's really less than 1 hour. Signs and symptoms should reduce. Okay, without giving any analgesia. Okay, for example, or swelling stops progressing, or reduce in the rate of progress. Patient feel much comfortable after that. Tadi tosis, sekarang dah boleh buka mata. Okay, we had a child. Oh gosh, another story. Came to my department after bitten by a cobra. She was collapsed, asystole, not breathing, no heart beat. We do CPR, 30 minutes, came back the heart, because the child collapsed most of the time is because of hypoxia, not because of the heart problem. You give enough oxygen, the heart will come back. So we gave antivenom while the child was still unconscious. Antivenom given 45 minutes within that administration, the child started to open the eye. Imagine you are now with the child, begging the child, suddenly your child open the eye. Because now it's all the neurotoxicity or the paralysis has been reversed. That's the miracle of antivenom, especially if it is neurotoxic. You can see immediate response in front of you. So the child was intubated, 2 hours later was extubated, doesn't have to be in the ICU, went into the PHDW. So again, how optimal management helps the patient. Are there limitations for antivenom? Of course, there are limitations. Not all species of snakes that with venom has antivenom. Okay? Is that correct? Not all species with venom has antivenom. So what about those with without antivenom and bite you? First thing is doa. Make sure you have enough, insurance. No, you still need to go to the hospital as soon as possible. There are ways that we can help you. Okay? So, antivenom is not all cure all, for all cure all. Now, this is just a summary again on how the process of antivenom management. You can have a look again later. Again, I would like to extend my invitation to all of you to register. Currently, it's still in early bird phase, which will end 30th of June. So, students, very good. It's flat rate for the whole process. Tak payah early bird. It's only one rate until besok nak start pun, you boleh register at the same rate. Okay, very, very cheap. It's meant for encouraging students to attend. Okay, that's it. I think, thank you very much. Questions? Yes, sir. Okay, you're talking about Bungarus flaviceps. Bungarus flaviceps, red-headed crane. There's no specific antivenom for it, okay? But we find there's some cross-neutralization with the other two crane antivenom.